Hey, it's Dr. Joelle, and welcome to the Women's Health Pro Show, where we have real talk about real women's issues. Since it's Bladder Health Month, we must talk about urinary incontinence because it's a real issue for a lot of women. About 60% of women can experience some form of urinary incontinence, which is leakage of urine. Women are experiencing leakage when they exercise, leakage during sex, which can be very embarrassing. And less than 50% of women are not seeking evaluation or treatment. So we are here to talk about those things with our expert. I am happy and excited to welcome Dr. Briana Walton, better known as Dr. Bree. She is a double board certified urogynecologist and also the owner of the Center for the Feminine Wellness and Surgery. Welcome, Dr. Bree.
Thank you. I'm so glad to be here with you tonight, especially this month.
Yes. So let's get to it. Let's talk about the different types of urinary incontinence. I have women come to me who are saying they're wearing pads all day. And I normally like to ask when they're actually experiencing the leakage. Is it, during when they're laughing, coughing, or sneezing? Or, again, when I mentioned when they leak during exercise. So I want to know from you what kind of questions or what kind of information you would want to know from a woman to kind of determine which type of incontinence she has.
Sure. So it's interesting because women can have a single flavor of incontinence or they can have a mixed bag, actually. Most women are very associated or knowledgeable about stress incontinence. And that's what you alluded to with cough, laugh, sneeze, exercise. So any increase in the pressure in the abdomen causes a release of urine. And many women will say, well, that's just normal. It's not normal. The other common issue is something called urge incontinence, where you have this, I need to go to the bathroom right now. If I don't make it there, I'm going to pee on myself. And it's commonly associated with the other symptoms of frequency, going too often, urgency, and nighttime urination. Those two can occur by themselves as well as occurring together. There's also less common leakage called functional incontinence. So some women begin to have issues with their back or have problems with walking, and they can't make it to the bathroom based on their ability to ambulate. So those are the big categories that we tend to look at.
Okay. So, yeah, and you mentioned, a lot of women are not either, they're trying to figure out what kind of incontinence they have. And they are either, so they have some leakage when they're coughing or laughing, which you mentioned is stress incontinence, or if they have the urge. They have to know when they go out where the bathrooms are, because as soon as they have that urge to go, they have to go right now. So urge incontinence, like you mentioned.
Some women will even get to the point where they're mapping for bathrooms. Like they could tell you where every restroom is in the mall. They could tell you on their route home the right places to pee and the wrong places to pee, which is pretty sad that we've gotten to the point where we've normalized the use of pads in order to take care of this issue. Like it's okay for a woman to wear pads. And you know that when they started making pads in the shape of a thong, that it's just wrong. A woman should not have to deal with this.
I totally agree. And some of the risk factors for urinary incontinence, as you know, can typically be a history of vaginal births and also with increasing age. And, as women these days are having babies later on in life, what are you telling women in regards to what they can do proactively to reduce the risk of incontinence issues after pregnancy?
So that's a really good point. I think what we underutilize for most women is we commonly as providers tell patients, go just do your Kegels, but the data really shows that most women don't do them correctly. Right. So one of the things to take advantage of that's paid for by insurance is to see a pelvic floor physical therapist, to have somewhat of a personal coach to show you how to contract and relax the muscles, because that's equally as important, and give you some idea sort of what's your baseline, because a lot of women don't really know the state of the union. They know that, okay, I might have these symptoms. They know that they have a vagina, but they don't really know themselves in the way of their support, and if anything is in the wrong position, and or if what's their muscle control.
That is so true. And you mentioned the pelvic floor physical therapy. I have a lot of women that I've mentioned that as an option, and they look at me like I'm crazy. Like,
yes,
physical therapy for the vagina? I didn't know that was a thing.
Yes, yes.
So
yes.
How do you approach women with that option? Because I know there's a lot of barriers to that, because the women feel, they're already embarrassed, they're having incontinence, and now they want to now they have to go somewhere to actually learn how to, exercise their pelvic floor muscles. So how do you give them, some reassurance that this actually is a thing, and it's a great thing that can actually help them?
So a couple things, and you asked really good questions, because that's one of the first things that people say to me as well. Like, they look at me like I've asked them to practice voodoo.
Right.
No, this is real. So I try to say, well, let's think of it a different way. If you had a muscle that was sore or achy on your shoulder, what would you do? You'd probably rub it. And if you weren't able to rub that muscle and get it sort of comfortable for yourself, then you would probably go see somebody like a physical therapist or even a chiropractor. So this is really no different. Get out of your vagina. Stop thinking about it as just a sex organ. It is an organ, just like every part of your body. So let's think of it this way. And you need someone to coach you to do these things properly, because right now, you're not. And so we want you to not harm yourself by actually doing them incorrectly.
Right. Good point. And I think another good point to bring up too is the other benefit of pelvic floor, learning how to exercise your pelvic floor. It can actually help with sexual health. So as far as,
I wasn't going to go there, but I can go there.
Let's go there.
It's true. I mean, for many years, there's some degree of mystery with regard to intercourse and having pleasurable intercourse, and almost narrating that intercourse with your pelvic floor, and the ability to control your pelvic floor allows a woman to have more sort of say-so on how things go. Right. And that, it opens up a whole new world for women in terms of understanding. Now, you said I could go there, right?
Yes, you can.
Okay. So, so for women, just understanding that there are multiple places that you can experience an orgasm. And most of us hear about the G spot, but the common areas, there's lots of different places. Women can experience them along the pelvic floor muscles. And so if there's been a change or modification in their ability to achieve orgasm, sometimes it's because after that baby has come out, it has changed the architecture of their pelvis.
Yeah.
So you want to try to regain that function as quickly as possible so that you don't lose it.
Right. So ladies, pelvic floor exercises, very important. And if you need a therapist to help you, please seek that out. So let's talk about some other strategies, though, that can potentially help, more so like lifestyle modifications. I know it kind of depends on what type of incontinence they have, but what kind of lifestyle modifications that women can do that will help them with their incontinence issues?
So I think it depends on what type of incontinence they have. So very commonly, the more overactive bladder person, so I usually refer to them, they're having way too much fun. Frequency, urgency, and nighttime urination, right? And they can have wet fun or dry fun. Mm-hmm. They leak or they not leak. And so for those patients, you want to start to avoid certain triggers. So bladder irritants, as we refer to them. Caffeine is a big common one, but some women don't know that bladder stimulants such as like the phenylalanines and aspartames, the sugar alternatives, can also stimulate these contractions. Pretty commonly, women will also, as we gain weight, that can affect you. And so modest weight loss can affect your ability to control your urine. I think, this is your lane right here where we talk about menopause and the effect that it has on the pelvic floor and specifically urinary incontinence.
Yes, very, very much so. And a lot of times with menopause, I usually recommend using like an estrogen cream, especially around the urethra. Can you talk about that, to kind of the benefits of that vaginal estrogen, adding that back during menopause or even perimenopause if women are experiencing the symptoms of, that dryness and that bladder irritation during that time?
Yes. And that's a great point. And so directing it towards the urethra, I think, is key. One of the concerns that women have, as you know, is the use of estrogens. And so I liken it to like you're just putting it on the outer, more like a lotion or a lipstick, as opposed to a substance or side effects from it. So a topical application of estradiol or some kind of estrogen can allow the body to do a couple things. One, you'll make more collagen, which increases tone, but you also make more of the right collagen or the more appropriate collagen. And then you also probably downregulate some of the contractile factors in the bladder, because the bladder, the vagina, and the uterus all come from the same embryological tissue. So the vagina just doesn't get dried, so to speak, so does the bladder.
Right. What are your thoughts about laser therapy to help with incontinence issues?
So I've been using it more often in the recent past. I started doing some research on it after, can I be honest, I actually was having some incontinence issues myself.
Okay.
And I
totally relate.
And the surgery improved my symptoms significantly, but it didn't take it away enough for me to say I won't do anything else. I really was still sort of wanting for more. And I was like, well, let me test this other treatment out. And so there are a couple out there in the way of radio frequency, which is passing a wave of heat, and it heats the tissue in order to treat it, or a traditional laser, which is more light amplification. So both of these mechanisms are thought to have the ability to, one, in the short term, change the contents of collagen. So, for example, if you fry an egg, you're not changing the egg, you're just denaturing the protein. It forms a different sort of way it bonds together, and that's the same thing that happens when you heat up our tissues. But then that injury that it causes could potentially also bring more collagen in a faster way than potentially using estradiol. I don't like to think of them as mutually exclusive. I think that using them together is actually very beneficial for those women who are a candidate.
Great. So yeah, I think those are very good points. Women, the take-home points are definitely women with urinary incontinence issues, any at all, should definitely have them be evaluated. It's something that they should not be ignored, because the other thing they need to be aware of is sometimes incontinence issues can present or be an indication of an infection. Women, don't think about that too. So they can also, certainly be evaluated for an infection if they have an incontinence issues. So I want to thank you for all that valuable information. I want to
say one more thing, because you brought up something that was so important,
and
I don't want women to walk away. So there are women out there who are experiencing some leakage with intercourse, and there's a couple different varieties. So I don't know if you want to talk about that on a different day or what, but it definitely deserves a little more thought, because there's a couple of different mechanisms that happen when people leak with intercourse.
Okay, let's talk about it.
So, some women will have complaints.
So let's talk about, I mentioned earlier, women having leakage with intercourse. And I think that's definitely something that a lot of women are, experiencing and not really saying anything, because it's, obviously quite embarrassing. So can you talk about Are there different types of leakage, during when women are having sex, or is this one certain kind? Can you kind of go in that direction and answering what that actually is for women?
Sure. So that, you're right. This is like if incontinence is a secret, then this is the dirty little secret. And sometimes I will counsel women until we get them treated that, just blame it on your partner. Say you didn't do it. Nobody can tell.
It's always their fault.
But there's really two qualities that I hear very commonly that women will complain of, either with penetration or with orgasm. So most of the time when patients complain of leakage right with entry into with traditional intercourse, it is either because there is a bulge there that sometimes a partner is running into and there's leakage, or there's weakness of the urethra. So more of the stress incontinence variety, or more of an anatomical problem. On the other hand, if a woman is leaking with orgasm, it tends to be more of a bladder spasm. And so that tends to be more medical therapy and or physical therapy as opposed to surgery.
Okay. So do you normally, depending on, either of those two, do you typically, if it's more of during orgasm, do you normally go straight to a medication, or you kind of do other things before going that route?
Very commonly, if they're having leakage with orgasm, they're probably having leakage with other things too. So most of those patients, I will tend to sort of go, kind of multidisciplinary treatment. So I'm not just trying one thing, I'm trying a lot of things at once, because they want it. If they finally showed up in the office and they admitted to this issue, they're ready for something. Right. They don't want to like nickel and dime. They were like, get rid of it because I'm embarrassed and I'm tired of it.
Right. And I think another point to that point is when we are treating women with these issues, to kind of give them the expectation of, you may certainly with treatment, you can improve. It may not be completely gone, but certainly you can have a significant improvement. And I think that we need to, have a
realistic. You're right. Absolutely. It should be a realistic discussion about the degree of improvement that they would experience.
Right. Okay. Well, thank you so much. That's such valuable information for our audience. And we will definitely have you back to talk about some more things.
I can't wait. I'm excited. Thank you. And thank you for putting this show on. This is such a gift to women, and to not just women, but to all of society as partners try to learn more about the ones that they love.
Yes, most definitely. And definitely, a conversation that we need to have repeatedly so women can feel more comfortable having it.
Absolutely.
And, I love your platform. Can you tell our audience where they can find you on social media?
Oh, yeah. On Instagram, I'm Bree Walton MD, and I think it's the same for Facebook, but I tend to be mostly on Instagram. As a Wednesday nights are our Instagram Live, where we have the first Tuesday of the month, or the first Wednesday of the month, we talk about issues regarding laser therapies and questions people have. The second is I interview pelvic floor physical therapist. And the third is the She Shed, which is my favorite, or sex health education.
All right, folks, this is Dr. JL. Thank you for tuning in to the Women's Health Pro Show, where we have real talk about real women's issues.